Soon after the COVID-19 vaccines were made publicly available in the spring 2021, the AAMC was awarded a multi-year cooperative agreement with the U.S. Centers for Disease Control and Prevention. This initiative supports improving access to healthcare, building strong community collaborations, and advancing health equity. Through the cooperative agreement, AAMC and our member institutions, medical schools, and academic health systems are building trust and confidence not only in the COVID-19 vaccines, but also in pediatric routine vaccinations across the country. And we're serving those most disproportionately impacted by the pandemic and its lingering effects.
Vaccinations have really changed the face of pediatrics in general, right? Not only are we protecting them against many preventable diseases and keeping them safe, we are also playing a key part in making sure that they're able to get into schools and be enrolled in the healthcare system here. So vaccination is definitely key in the pediatric world and on our mobile clinic.
We have two strategies to work with our grantees across the country. One is about collaborating with trusted messengers. These can be faith-based leaders or community leaders, and they know their communities best because they're on the front lines and have some deep understanding and listening with those communities so that we can tailor communications activities and really deliver vaccines where they're needed most. Second, we're partnering with local, regional, and national partners to develop strong community collaboration. This can involve public health departments, social service agencies, and we have a partnership with the Children's Health Fund. And this is about delivering vaccines to where people are through mobile clinics in areas where folks are disproportionately impacted by the pandemic.
We worked side by side to really understand how best to reach some of these children and families, how best to educate them about the vaccines, and really being strategic about how to get the most bang for the buck. It's really important for people to understand that we have more than 20 million children in this country that are lacking the health care that they need and deserve.
The biggest issue is actually access. The biggest issue is being able to approach healthcare in a language that you know, in a setting that you trust, with organizations and community partners that you trust. And so to really improve healthcare for underrepresented populations, for oppressed communities, we need better access. We need to work in community-oriented care so that we're addressing their needs and working with partners that can facilitate those connections.
Through our grantees, in just 1 year, more than 62 new partnerships have been established, and these are really essential to ongoing efforts, not just during the pandemic, but beyond. In fact, just as one example, in 3 mobile clinics, more than 5,000 children were vaccinated for pediatric routine vaccines or COVID-19.
A resource can change a person's life. That's really our passion, bringing access, bringing resources, bringing opportunities to low-income communities.
The AAMC, our member institutions and communities are doing this work, sometimes in ways that are new, creative, and different. AAMC is invested in this work because it aligns so closely with the AAMC's mission to improve the health of all everywhere.